Hello, my name is Sarah Reaping, and today we're going to talk about teen suicide, a perspective of a public health nurse. As a public health nurse, I not only have the knowledge of nursing, but I also have the knowledge in terms of social skills, meaning I have the ability to talk to people in a variety of different situations. So first, let's identify the problem. Teen suicide is the third leading cause of death among adolescents between ages 10 to 24, and the sixth leading cause of death for ages 5 to 14. Females aged 10 to 14 have the largest spike in suicides compared to other age groups in the United States. In the year 1999, the rate was 0.5 per 100,000, and in 2014, this was increased to 1.5 per 100,000. In Connecticut, the suicide rate is 7.04 per 100,000, aged 15 to 19 years old. Males having a rate of 9.95 compared to females, which is 4.0 per 100,000. Although, females are twice as likely to attempt suicide than males. The reason for these disparities are most likely because males are using more lethal means when attempting suicide than females. There are also other ways to identify the problem, like looking at areas that can negatively impact a teen. Items like puberty, depression, mental illness, bullying, home environment, and traumatic experiences. In terms of the social determinants of health, those that can be negatively impacted are income, education, safety, social norms / peer influence, access to resources, and social support. All of these things we have discussed are ways we can identify the problem. So for our problem statement, the core problem in Connecticut regarding adolescent suicide are that females are more likely than males to attempt suicide because of social media, depression, mental health, puberty related to hormonal changes, bullying, body shaming, family issues, and isolation. To get more in depth into what we're talking about, we're going to look at teen suicide in a social ecological model. This model involves multiple levels. They are individual, interpersonal, organizational, community, and policy. Let's start with individual. For this, we're going to look at what promotes and hinders. So at this level, what promotes are when parents are talking with their teen in a positive manner for understanding and supporting them during this time. In terms of hinders, females who are going through puberty, which has the potential to make them think differently about themselves and about their bodies. Mental health, like depression. On the interpersonal level, what can promote health are participation of support groups. An example of what could hinder are things like family situations such as divorce, mental illness, separation, moving, families that are involved in the military, financial difficulties, and another one is bullying. On the organizational level, what can promote health are school-based programs on teen prevention, and what can hinder is lack of coverage of medical care for teen suicide. Next, community level. What can promote health are participating in the suicide hotline calls for prevention, and what can hinder is the social media stigmatizing teen suicide like mental illness. On the policy level, Connecticut works with a school health survey in coordinates with the Youth Risk Behavioral Survey and looks at things like the hospital inpatient discharge database, for example, the one in 2012, for information about teen suicide. And a policy level that can hinder is the lack of legislation in Connecticut regarding teen suicide. So now that we looked at multiple levels of where teen suicide is and the problems facing it, now we're going to look at some interventions that we can do to help prevent teen suicide. So the first one is going to be about school-based programs. These are programs within the school where students and teachers and parents can learn about things. So here we're going to have a set of videos for students, teachers, and parents on the signs and symptoms of teen suicide. There's going to be things like warning signs, common risk factors, common myths about suicide. We'll also touch on social media here, which is a great new um, factor that needs to be talked about within teen suicide. And then they'll develop skills for coping and engaging with others, and they'll learn about mental health and substance abuse. And overall, this will be to increase knowledge and awareness. Our second intervention will be for support groups for teens. Having a support group is a way to build a community within each other and so that you can have a positive place for teens to go to. Obviously, this will be for just girls within Connecticut, and it'll be for those who have attempted suicide so that they can express any concerns and ask questions and relate to one another on things that they're dealing with on a personal level. This will also be a place for them to continue to develop coping skills to prevent another attempt, and obviously to build more skills within themselves so that they can think more positively about themselves and about one another. Lastly, we'll do a hospital training program. When a teen does attempt suicide, they will most likely go to the hospital, and to be exact, they'll probably first go to the emergency room. So here, nurses will be provided training regarding different evidence-based techniques when taking care of a teen who has attempted suicide. This training will also include how nurses should interact with families. Families are obviously very concerned about their teen, and the person who's seeing their child the most will be the nurse. The nurse will learn different techniques on how to talk to the families. And this is aimed to start the healing process and to motivate the teen and family to attend outpatient treatment and to decrease hospitalizations and suicide attempts and just start this process. So, now that we've identified our 3 interventions, we now need to discuss how we're going to evaluate them. So, for interventions 1 and 3, so this would be the school-based program and the hospital training program. They will be provided with a survey, so a pre-test and a post-test. So with the school-based program, teens, families, and teachers will be given a pre-test before the program begins to give a baseline about how they feel about teen suicide. And then once the program is done, they'll be given a post-test. Within the program, we hope within that there'll be a 60% increase in adapting the following skills. So behavior change, increase in awareness and knowledge, in coping skills, ability to identify depression signs and symptoms, increase ability to resolve conflict, and increase self-efficacy and manage anger. With the hospital training program, we hope for a 70% increase in competencies will be expected for the increase in knowledge and awareness of teen suicide and ability to effectively deliver evidence-based counseling techniques for teen suicide. For intervention 2, which is support groups for girls in Connecticut who have attempted suicide, they will be giving evaluations, which will be given at the end of each session. We hope for a participation of 40 or more of the evaluations, and that after the teen has done 3 or more sessions, we will expect a behavior change within that teen with compliance with the forms. With any intervention or program strategy, you have the potential for challenges, and we have identified the ones that we think will be on the largest scale. First one being participation of surveys and evaluations. Second will be attendance for support groups. Third will be partnerships with schools and hospitals. And lastly will be funding. How we hope to solve those is to provide incentives for participation, meaning that we will give things like freebies, giving out certain things during the programs, engaging in the community, trying to really give any kind of incentive so that they will come to the programs and to the support groups or trainings. We will also make sure that we provide enough time for individuals to answer questions and evaluations and for them not to be pressured to get them done in a timely manner. That we want them to take their time with it. In terms of funding, we'll definitely work with local stakeholders within Connecticut, and if needed, we'll apply for a grant. And then one of the things is we need to partner with schools and hospitals in Connecticut, and sometimes there may be, a little tension with that. So providing a presentation before the programs begin to leaders within these facilities on the benefits of the program so that they will want to have them at their facility. Lastly, the logic model is a great way to look at how every piece within what we've talked about today goes into one model. So first part of the logic model is the resources and inputs. So first, I've identified a team which includes the public health nurse, an epidemiologist and researcher to gather data, and then counselors and psychologists, which will give expert testimony. And then within the community, we need participation from schools and hospitals and other facilities. We'll also need community leaders to help us, funding, ability for educational materials, and meeting places for meetings and for current activities. Next, we identified our three activities, which would be the school-based program, the support groups, and the hospital training. Next will be our outputs. So we're going to hope for a good number of surveys administered and completed. Participation of the teen during the school-based programs, the support group, and to interact with the medical staff. Participation of the families during the school-based program and during the support group, meaning that although they will not be in there, but in the support group themselves. But we need to make sure that the families do not feel, sometimes families can feel that they don't want them to go to any kind of outpatient treatment because they don't want to make sure their teen doesn't have a problem, but just reassuring them that everything is okay. And for them to interact with the medical staff, participation of the medical staff or the nurses with the families and with the teen, and also with school leaders to participate in the school-based program because the teachers are with the students a good portion of the day and they can really influence. Our outcomes of these programs would be to increase awareness and knowledge, increase coping skills, identify depression, parents to gain skills on talking with their teens, resolving conflict behaviors, increase in self-efficacy, ability to manage their anger, and increase training and knowledge and behavior for the medical staff. What we hope to impact would be to decrease the incidence of teen suicide and attempts with females in Connecticut. And for these programs or these activities to be a routine and continuance of the programs, and to obviously improve on medical coverage for teen suicide. Here are a list of my resources, and I'd like to thank you for listening about teen suicide, and hopefully you've learned something and we can keep marching on to solve this public health issue. Thank you.